Hello everyone, this is Dr. Manohar K N. Vaccine may sound like music to some, but it may ring alarm bells to others. So, what is this vaccination? The development of immunity could be by a natural process when we get an infection from any organism. Otherwise, artificial immunity or acquired immunity can be induced by this process called vaccination. So, vaccines generally contain some parts of the virus or the other organisms wherein it elicits an immune response to this particulate without causing the disease. So, that is in short about vaccination. Even though there are innumerable diseases, there are only a handful of diseases which we have vaccines available for. So coming to this COVID-19, what are the types of vaccines which are available? So in simple terms, we have the American vaccines, the Moderna and the Pfizer BioNTech, which are called as the RNA virus or RNA types of vaccines. The important thing which we need to remember is it requires quite stringent measures to store, like minus 20 degrees Celsius for Moderna and minus 70 degrees Celsius for Pfizer. The other two are Oxford AstraZeneca vaccine and the Sputnik vaccine from the Russians. They are called vector vaccines or viral vector, genetically modified viruses are used here, and the storage is a bit more relaxed in these two vaccines. So the Americans requires too much of coldness to store, minus 20 to minus 70. Oxford and the Russian Sputnik, storage is easy, 2 to 8 degrees Celsius possibly. So when do we get vaccines in India? Most likely by Jan, definitely by March, April. So it will be rolled out. I think the government is doing a good job. They have made this CoVid registry and it will be rolled out throughout. And as we understand, the healthcare professionals are the first to get, and then in a phased manner, high-risk individuals, older ones, and who have other comorbidities. And so in a phased manner, it will be rolled out. Who should take the vaccine? If you ask me, everyone should take it, including people who already had COVID. So that is the place where it is of maximal controversy, that if someone has developed COVID, should he take the vaccines? The answer as of now is yes, 2 doses after 90 days of the said COVID infection, you can take the vaccine. Why? Because many times we have noted that the antibodies produced by the infection are not long lasting. So possibly the vaccine, we still don't know how long the antibodies or the immunity given by the vaccines, but at least I'm sure it will be more than 90 days for sure. So everyone should take it, even though it is not tested in the pregnant ladies and children. If someone is willing to take it, it should not be denied is the consensus now. It should be in 2 doses, 3 to 4 weeks apart. If someone can forget the dose or someone has forgotten the dose, they should take it immediately when they remember. And it is preferable to take the same vaccine and not to interchange one vaccine to the other when they take the dosage. So why should I take the vaccine? Vaccines offers anywhere between 65 to 95% immunity. So if most of us are taking it, it provides a good herd immunity. And when we get infected, we don't know who is going to get severely infected. Some side effects, of course, there are a lot of fear mongering which is happening with respect to the vaccines. Most reports are wrong, at least to my knowledge. So there could be some local reactions of pain, fever, which may last for a day or two. Sometimes if you have an allergy, rash can come up. But generally the vaccines are well tolerated. Very rare reactions of the neurological system has been reported, like what we call it as a Bell's palsy or other neurological issues are there. But every vaccine can produce that. So does this. I know the concern is more because we developed the vaccine far too fast as compared to any other vaccines. But I'm sure the vaccines are here to stay. Maybe the vaccines which we get later could be better because we will have more information. But if I were you, I would take the first available vaccine, 2 doses, 3 to 4 weeks apart. Thank you very much.